Thanks, Kate. And I second your greetings and wishing Happy New Year to everyone who joined us today. Thank you again for being with us. I will talk about our Omicron surge, the epidemiology, the hospitalization and death updates, information on testing and our efforts to make rapid tests more available, information about vaccines and booster progress, and take your questions. But I first want to start again by acknowledging the ongoing stress, fatigue, and disruption that the COVID-19 pandemic is continuing to cause for our community and for all of you after two long years. I mean, I am feeling it. I know our team here at Public Health is feeling it as they work as hard as they can in continuing to support our community. So thank you again for your perseverance. We will get through this. Now, I'm going to transition to the epi update. And as of this morning in King County, we're reporting 229,982 cases, 9,495 hospitalizations, and 2,197 deaths from COVID-19 throughout the course of this pandemic. The speed of spread of Omicron has been mind-boggling. Our University of Washington colleagues estimate Omicron is currently responsible for 90% of local COVID-19 just a month after it was first detected. And over the last 7 days, we've seen a record-breaking average of 3,323 cases reported each day. That's more than 4 times our previous peak from November 2020, and approximately 12 times more than the number we saw in early December 2021. Our 7-day incidence rate is currently 1,029 per 100,000, corresponding to a very high level of community transmission, and that's being seen across all age groups. The 7-day incidence is currently highest among 18 to 24-year-olds, followed by 25 to 34-year-olds, and 35 to 49-year-olds. Youth rates are close to or below that of the 18 to 64-year-olds. People who are unvaccinated continue to be at the highest risk for COVID-19 infection, hospitalization, and death, although we are seeing an increasing number of less severe infections among vaccinated people. In the 30 days through the 22nd of December, people who were not fully vaccinated were 2.5 times more likely to develop COVID-19, 13 times more likely to be hospitalized, and 27 times more likely to die from COVID-19. For example, on January 2nd, the risk for hospitalization for unvaccinated people was 10.6 per 100,000 per day, while for vaccinated people, it was less than 1 per 100,000 per day at 0.92. Now, our vaccines, especially with the booster dose, are holding up very well and providing most people with excellent protection from what matters most, serious infections. But with Omicron, even vaccinated and boosted people can become infected and spread the infection to others. So we can't rely on vaccination alone when transmission levels are this high. We need to use the same multiple layers of protection we've used in the past. Along with vaccination and boosting when eligible, limiting indoor activities, and especially avoiding crowded and poorly ventilated indoor spaces is important right now, along with using high quality, well-fitting face masks or respirators, making sure we have good indoor air quality and ventilation, and isolating away from others if you're ill, quarantining away from others if you're not up to date on your vaccination and are exposed to someone with COVID-19, and getting tested when possible if you have symptoms or are exposed. Together, these strategies provide the additive levels of protection that we need right now. I'll pivot to speak about hospitalizations. In contrast to the tenfold rise in cases, hospitalizations have increased approximately 5-fold from mid-December, when we were averaging about 7 per day, to an average of about 34 per day the week ending January 3rd. And that's 1 person hospitalized every 45 minutes in King County hospitals currently. The increase in hospitalizations coming on top of the Delta surge and an increase in non-COVID hospitalizations along with worsening staff shortages and challenges discharging patients, is stressing our hospitals now more than ever. As of today, there were 400 patients with COVID-19 in King County hospitals, which has exceeded past peaks from past waves, and it is the highest number we've seen to date. The previous peak was 331 on August 3rd, 2021. Just over 1 in 7 of all our acute care and ICU hospital beds are occupied with people with COVID-19. The current hospitalization rate of 10.7 per 100,000 over 7 days is close to the winter 2020 peak, and we expect hospitalizations to continue to rise and healthcare system stress to continue to increase for several weeks after cases peak. Now, this rate of 10.7 per 100,000 per day is comparable to the peak level of hospitalizations we've seen in the last 11 influenza seasons. So our average peak hospitalization during the past 11 influenza seasons is about 5 per 100,000 per 7 days. 10.7 per 100,000 per 7 days is matching the peak level we've seen in the past 10 years of influenza seasons. Over the past 7 days, 241 King County residents were hospitalized with COVID-19 compared to 132 during the previous 7 days, which is an increase of 83%. And most recent hospitalizations are among 40 to 69-year-olds and those over 70 years, followed by the 20 to 39-year-old age group. Hospitalization rates increase for adults with age and remain very low in youth. We have not seen any major change in our death trends at this point. Deaths have fluctuated between 1 and 3 per day since mid-November. Last week, we reported 2 deaths per day. And over the past 2 weeks, we reported 33 deaths, and that's compared to 17 during the 2 weeks prior to that, which is within the range of recent fluctuation. So I want to just step back for a second, try and put some of this Omicron surge and complexity into context. Omicron is challenging us in new ways. Our colleagues at the University of Washington estimate that 90% of local cases are now Omicron, and some have predicted Omicron will peak locally in mid-January, although we can't know with certainty whether the current surge will peak at that time or how long a peak will last, although it will likely continue to impact us for many weeks after the peak. We also can't be sure how closely we'll follow outbreak trends from other countries, given differences in age distributions and underlying health conditions of populations, differences in vaccination coverage and past infection rates, differences in the season of the year in some countries, in different hemispheres, and social mixing and behavioral differences. Things are likely to get more difficult before they get better. We all need to plan for large numbers of people being ill in a short time frame and resulting absenteeism in workplaces and its effect on operations. And with respect to the issue of Omicron being milder than Delta, it's true that although Omicron illness is uncomplicated for most people and does not appear to be as severe as that from Delta for individual patients, especially those who are vaccinated and boosted, it's not a mild illness for many. The potential for long COVID remains, and its impact on our community and our healthcare system's ability to provide us with the care we need for all sorts of health problems is equally, if not more severe than past variants. So although it may be milder for individuals, Omicron is not necessarily milder on communities. I'll say a few words about the new CDC isolation and quarantine guidance. This guidance has received a lot of attention, much of it not for the reasons the CDC wanted. Like much about COVID-19, it's not simple. I'll try and boil it down. Let me start by just clarifying. Isolation is staying away from others when you have an infection that can spread easily. And quarantine is staying away from others when you've been exposed to someone with an infection so that you are not becoming infected and then spreading it to others in the community. So isolation basically is what sick people do, and quarantine is what people do when they've been exposed. So if you test positive for COVID-19 or have symptoms but can't get tested, isolate at home away from others for at least 5 days. Wear a mask around people in the home and increase ventilation in the home. At the end of 5 days, if your symptoms are improving and you haven't had fever for 24 hours without taking Tylenol or other fever-reducing medications, and you feel okay, you can leave home, but you must use a high-quality, well-fitting mask when around others at all times for another 5 days. You also need to avoid contact with people at high risk for severe COVID, like older adults and people with immune compromise. And if you can't wear a mask when around others at home, stay at home and isolate for another 5 days for a total of 10 days isolation at home. If you're exposed to someone with COVID-19 or who you think has COVID-19, you should quarantine at home if you're not vaccinated or are an adult who hasn't been boosted, or if you're under 18 and not vaccinated or haven't completed the primary vaccination series. If you're in those groups, you should quarantine away from others at home for 5 days and wear a good quality, well-fitting face mask when around others at home. And then at 5 days, if you can get tested, get tested. If you test negative, you can leave quarantine at 5 days, but you should continue to wear a high-quality, well-fitting face mask around others for 10 days after your last contact with the COVID-19 case, and also avoid being around other people at high risk for COVID-19. If at any point you develop symptoms, you should get tested and isolate until you have the result. Now, you do not need to quarantine if you're 18 or older and have received all your recommended vaccine doses, including boosters and additional primary shots for immunocompromised people, or if you're ages 5 to 17 and have completed your primary series of COVID vaccines. Likewise, you do not need to quarantine if you've had a confirmed COVID-19 case within the past 90 days, meaning you tested positive using a viral test. And we'll put the link to the complete CDC guidance in the chat so that people can review all the details around this guidance. So what I provided was a summary, but the information that you would need if you truly are isolating or quarantining, it is more than what I've covered. So please take a look at what's on the CDC website. Now, I'll say a few words about testing. With the very high case rates that we're experiencing locally, nationally, and around the world, the test sites are experiencing extremely high demand. In addition, many of our test sites have had to close or operate at reduced capacity because of winter weather impacts and staffing challenges due to our own staff developing COVID-19. Our teams are working hard to get back to full capacity as soon as possible. But despite these setbacks, in the last 2 weeks, King County and the City of Seattle free test sites conducted over 117,000 tests. That's from December 22nd through January 4th, over the holidays. And we are doing everything possible at this point to get more rapid home tests into the community. The county just purchased 700,000 rapid tests directly from manufacturers, and the first 100,000 will be distributed starting Monday. And these kits initially will go to long-term care facilities, emergency medical service providers, and healthcare facilities with urgent short-term needs, as well as correctional facilities and other high-risk congregate settings, and then community organizations in areas of greatest need, including shelters and senior centers. Community health centers and community testing sites will also receive tests when we get them, and these organizations have been contacted and are expecting the kits. We also anticipate receiving up to 10,000 rapid tests a week from the Washington State Department of Health, which we're very grateful for, and we will also distribute those to the community. And yesterday, the governor announced Washington State will be receiving 3.5 million additional tests, and we should be receiving a portion of these, and we'll likewise distribute those to the community. We've also requested support from federal agencies to stand up more testing sites. Now, given the high demand for tests that exceeds the capacity currently, we have a few requests for the public. First of all, if you have a regular healthcare provider or a pharmacy that you go to, please check with them before trying to schedule a test at our free King County test sites, because that will allow us to preserve our limited testing capacity at the King County sites for those who don't have access to other healthcare resources. And please don't go to emergency departments or urgent care clinics just for COVID-19 testing. They're overloaded caring for ill patients, and they can't provide testing for people who don't need emergency care. So given that the tests are hard to come by right now, here's some guidance if you do have symptoms or an exposure but aren't able to get tested for COVID-19. If in doubt, sit it out. If you have symptoms but don't need medical care, you may have COVID-19 and should isolate away from others for at least 5 days. If you're exposed to someone with COVID-19 and need to quarantine but can't get tested at the 5-day mark after your last COVID exposure, you can leave your home after 5 days if you haven't had symptoms. Just wear a mask for at least 10 days after the last contact. And if you develop symptoms, isolate and follow those guidelines for isolation. And again, more information on both of these topics is available online from CDC, and we've shared those links in the chat. And finally, it's important to understand that our COVID-19 tests are very useful tools, but they're not perfect. Although a positive rapid test is a good indicator that someone's infected, you can have a negative rapid test even if you are infected, especially in the first few days of infection. So if you have symptoms or have been exposed to someone with COVID-19 and test negative, continue to take precautions and test again in a day or two if possible. Repeat testing is more useful whenever it's available. Now, on to vaccinations and boosters. I'm very gratified to report that over 86% of eligible King County residents 12 years of age and older have completed their vaccination series, and 93% have started the series. That is outstanding. Thank you to everyone who has been vaccinated to protect themselves, their loved ones, and their community. Our youth vaccination rates are increasing, and we need to keep it up. Almost half of our 5 to 11-year-olds have started their series, and 37% are now fully vaccinated. And about 80% of our 12 to 17-year-olds have started their series, and 3/4 are now fully vaccinated. These numbers are going to drastically protect those people from serious COVID-19 outcomes. And it's a tremendous benefit, not only to the individuals who've been vaccinated, but to others in our community. Thank you to everyone who's being vaccinated. I also want to remind that booster shots are very important to keep the level of protection up, especially against serious infection in adults. More than 800,000 booster shots and third doses have been administered in King County. 75% of those 65 years of age and older have been boosted. 53% of those 50 to 64, 42% of those 35 to 49, and only 26% of those who are 18 to 34 years of age have been boosted. So we need to continue to make progress with these very important booster shots, which are really required to get the full benefit of the vaccination series. The most important single strategy we have is continuing to vaccinate and boost when eligible. And we know that booster and vaccination demand remains high. And it's still difficult for everyone to find a convenient same-day appointment. We understand that, and we're doing all we can to increase capacity. And it has improved significantly, and we're continuing to expand it further. Our Auburn Mall vaccination site, which serves 600 people per day, is open 7 days per week now. Our FEMA vaccination site has moved from Federal Way to the Auburn GSA site. That's also now open 7 days a week. Appointments for both of these sites are encouraged, but drop-ins are accepted. And we anticipate opening additional vaccination sites this month in Renton and downtown Seattle. And we're continuing to hold numerous community-based pop-up vaccination clinics and school-based clinics. Information on finding vaccination and booster sites can be found at kingcounty.gov/COVID/vaccines. We're also working to distribute masks to community groups, to our cities within the county, and to food banks. over 1.6 million surgical masks, and over 200,000 N95s were distributed to approximately 200 community groups, cities, and food banks in December. And this month, we plan to distribute another 135,000 KN95 masks to over 100 community organization groups. And we're aware that the state is planning to distribute roughly another 10 million masks statewide. So this is a very important measure to help us limit the risk from COVID-19. So with that, I'll pause and I look forward to discussion with you.
Thanks so much, Dr. Duchin. And a reminder to reporters, if you have a question, please use the raise your hand function in Zoom to get in line to ask a question. So first question is from Carla Johnson with Associated Press. Carla, go ahead.
Hi, thanks for holding this and thanks for taking my question. Is the pace of vaccination in younger children and teens slowing down? And if so, is that related to the holidays, or do you think parents aren't really very worried about Omicron for their kids?
Mm-hmm. Well, the pace definitely slowed recently. And, we can only guess at the reasons, but I think two very likely reasons are the ones you mentioned: holiday season with people doing, travel and gatherings and other things, and also the serious weather problems that we had with the freezing temperatures and the snow. So we've had unfortunate climate events this year that coincided with COVID-19. We had a blistering heat wave in the summer, and now we've had this really bad spell right at the time when we were accelerating our vaccination efforts. So we'll have to see what happens over the next few weeks. We expect that our vaccination numbers will rebound. We had vaccination sites closed due to the weather, and we're now ramping back up again. So I anticipate that within the younger age group, the 5 to 11, that we'll continue to see demand. We have a quite a high proportion of the older, the adolescents and older children, the teens vaccinated. So once you reach that high level, demand typically does fall off a bit, and we will continue to make vaccine available. We know over time, some people who weren't early adopters will decide that vaccine's the right thing to do to protect themselves or their children. We want to encourage that, and the door is always open to people, regardless of how far out they are in their decision-making process. But I anticipate we'll see demand both for boosters and adults, and for the most newly eligible 5 to 11-year-olds pop up again now that the holidays are past and the weather's improved.
Thank you. Next question is from Joey Thompson with Puget Sound Business Journal. Go ahead, Joey.
Hi, Dr. Duchin. Thanks for taking questions. First off, can you put a little more context into what we might see in the next month in terms of disruptions from losing large chunks of the workforce? I mean, I'm thinking about grocery stores and bus drivers, schools, childcare. What percentage? I mean, maybe not a percentage, but what should folks be expecting with their workforce? And then also, hearing earlier this week from hospitals saying that they're the closest they've ever been to crisis standards of care, and seeing how the UW's modeling shows potential of, upwards of 40,000 cases a day across the state. Is it realistic to think in 2 or 3 weeks we won't need capacity restrictions to come back in certain events?
Okay, thanks. So first question about what to expect. They're related, your two questions. I think people are feeling it already. Many of us know people who've been infected. Many of us are working in environments where many of our colleagues have become infected, and the impacts on the workforce across all sectors are going to be significant. So I think what everyone needs to plan for, relatively high levels of absenteeism and what that means for their operations continuity, and do whatever they can do to either prioritize the limited resources, human resources that they will have for their most essential operations, or plan to manage to the best they can, anticipating 10-20% of the workforce may be out at any given time. It was for this reason that the CDC revised our isolation and quarantine guidance to acknowledge that the impacts on the workforce across the community for essential things that we need, like food and utilities and healthcare, transportation, and other sectors, are going to be significant and profound, and we need to be able to continue with the function of society to the greatest extent possible. And that will mean having people be able to leave isolation and quarantine sooner. There's clearly, trade-offs, but I think that most agree that the relative risk of people coming out of quarantine a few days earlier or isolation a few days earlier is offset by the benefits of having folks that can perform essential services that we all rely on to function in society and to have the essential things that we need. With respect to the hospitals, we're really encouraging our healthcare system to be in very close communication with the state, and I think we're seeing that yesterday. The Washington State Medical Association and the Washington chapter of the Academy of Emergency Physicians, provided a very clear statement about their assessment of where the healthcare system is at. We've got our Northwest Healthcare System Response Network in our region, which is a consortium of our local healthcare facilities that work together to manage these types of surges by sharing resources and information and strategizing, and all in very close contact with the state and the governor and the Department of Health to sort of try and provide as much relief as possible to the healthcare system. I think this is the single greatest priority that we have right now in the community, is to help the healthcare system at the policy level, at the administrative level, and as individuals, at the community level, with decreasing the amount of COVID that to the extent possible, but also to relieving the healthcare system of some of the barriers that they're having discharging patients, and to minimize the number of new patients coming in. So it's hard to predict, whether new restrictions per se will be necessary. I mean, clearly, I think the public gets what's going on. They understand that we're in the midst of an unprecedented, large outbreak that is threatening, continuity of operations, not only of the healthcare system, but of many other sectors. And we know what to do to limit transmission. It's something that we've done very successfully in the past. And I think that we will see our community respond. I mean, I know based on my own personal experience that people are canceling things because they know that's the right thing to do. They're not gathering because they know it's the right thing to do. Scheduled events aren't happening because the organizers understand that they don't want to risk increasing levels of COVID right now. So, COVID is going to be a long-term problem for our world. And, I think everyone wants to avoid, this sort of whack-a-mole restrictions and mandates, reflexively and reactively, and move towards a strategy where we can manage this disease by using the tools that we know work on a routine basis. The masking, the vaccinations, primarily the two biggest and most important tools, vaccination boosting, and using high quality, well-fitting face masks, and then layering upon that, when necessary, what we need to do now, such as voluntarily limiting gathering with others, avoiding crowded indoor spaces, avoiding poorly ventilated indoor spaces to the greatest extent possible. So whether or not additional restrictions beyond that will be useful or meaningful, I can't predict. But I'm very hopeful that our community will hear this message that's coming from our healthcare system, that we'll be able to take steps to relieve the healthcare system, and as government and as community members both.
Great, thank you. Next question is from Erica Barnett with Publicola. Erica, go ahead.
Hi, Dr. Duchin. Thanks for taking my question. This is about shelters, emergency shelters, and homeless shelters in general. What is the policy? There have been outbreaks in shelters. Obviously, they're congregate spaces. There was an outbreak at City Hall during the winter emergency. What is the current sort of protocol for outbreaks in shelters? Is it to sort of shelter in place? And is there a threshold over which, people will be sent to isolation and quarantine, knowing that there's not an infinite supply of those beds?
Yeah, Erica, this is another challenge. I mean, I would say this Omicron surge is overwhelmed every aspect of our response. And we're seeing, when you have large numbers of cases in the community, record-breaking numbers of cases, you have lots of outbreaks too. And, the situation in vulnerable communities like congregate settings like homeless shelters has always been a challenge from the get-go. And we've responded to that by establishing isolation and quarantine facilities. And, this Omicron surge is now overwhelming the number of available spots that we have in those facilities. And we're working actively to acquire more spaces. But I don't believe that we're ever going to be able to keep up with the number of cases that will occur, and we're not going to have isolation and quarantine beds for everyone. So we are actively now working with shelters to allow them to manage as safely as possible people who have COVID or have been exposed to COVID and for whom we don't have in our community another isolation or quarantine option. We have been providing guidance and resources like test kits and masks to shelters for this purpose as well. So, the strategy, the ideal strategy, the optimal strategy is, isolate and quarantine in a safe and separate facility away from others, but that's just not possible right now. And I think we'll see that in many settings that the sheer number of people who become infected will overwhelm the ability to have everyone move into a separate isolation or quarantine setting. So yes, the bottom line is that people will need to do the best they can under very difficult circumstances. And we are trying to provide whatever resources and support we can to shelters to minimize the risk to others in that environment. It's a very difficult situation for everyone.
Thanks, Dr. Duchin. Next question is from Keith Eldridge with Como News. Keith, go ahead.
Doctor, what should we take away from this? Because we're hearing this, DOH had these messages yesterday, you're delivering them today. How do you get through to people who are just done with this and they're going to go about life as they know it? And what's the urgency that you can convey today that will help us get the word to them that they really need, that this is serious and it's not going to go away unless they help?
Well, Keith, from the beginning, we've relied on the common sense, good judgment, intelligence of our community to help us get through this pandemic. And I believe that the vast majority of King County residents understand what's going on. And, around us, we are hearing from our healthcare system a plea for help. Not only a plea for help to governmental organizations, to the governor, to the Department of Health, but a plea to the community. And I think, everyone understands that our healthcare system needs to be there for us when we need it, for whatever we need it for, whether it's COVID-19, for a heart attack, for a stroke, for an accident. There are people who now have to wait for things that they otherwise would have been able to get in hospitals, procedures, tests, and evaluations. So this is, causing a profound effect that will have lasting consequences, and will take many months for people to catch up with the ability to receive the healthcare they would have otherwise received. So there's that piece of it. The healthcare piece is that even if you personally don't feel that you're at risk for COVID, and certainly if you're vaccinated and boosted, you're very well protected and you're not at high risk. But you also understand that you can become infected with Omicron, unfortunately, and you can spread it to others. So even if you're vaccinated and boosted, it makes sense to limit your activities right now. If you're not vaccinated and you're not impressed by COVID-19, and you don't feel like you're worried about the significant personal risks that you take, if you're particularly an older adult, for being hospitalized or dying. Again, there's that issue of caring for your neighbor, your family member, your coworkers, and in your ability to protect them by protecting yourself. So maybe hearing that again, or becoming aware of that, if you weren't aware of that, will help. But I think that it's inevitable that people are just fatigued after 2 years, going into the third year of this outbreak, and don't want to deal with it. I understand that. I don't want to deal with this. I want to be dealing with other things as well. But I think we have to, if we're going to be responsible citizens, if we care for those in the community, if we care for our family members, we will take the steps that are necessary now, even though they require additional effort. They may be onerous for some. This is an extreme situation. We've not been through something like this before as a country in modern times, as a society in modern times. And I think most people will inevitably recognize that, or have recognized that, and will do the right thing.
Thank you. Next question is from Elise Takahama from Seattle Times.
Hey, Dr. Duchin, thanks so much for taking questions. So you mentioned that this Omicron surge, as right now predicted, could peak in mid-January. But can you talk a little bit more about that and what that's based on, how we're projecting that? And then more specifically, if cases are likely being undercounted now, as we've heard, how we'd even be able to be sure of a peak?
Yes. So let me start with the second part, the case counting. It's true. We've never been able to count every case, right? We've always recognized that the number of cases that are reported represent a fraction of all cases, because there's a significant number of cases that don't have symptoms, don't get tested. And then there's cases that have milder symptoms and don't get recognized as COVID, yet they can still transmit it. They can still get long COVID, but they don't get tested and reported. So we always know, testing is an indicator, but not an absolute perfect indicator of the burden of disease in the community. Now we have the additional complication of rapid tests, at-home tests that don't get necessarily reported into the public health system. So our ability to accurately understand the exact number of cases is lower, but we still have large numbers of people getting tested. We have lots of testing access to the community, and we have a very good way to understand the trend that's happening, and we will be able to, I think, over time, be able to extrapolate from the number of cases are reported, what number might otherwise be unreported, and then estimate the total number. I think for our purposes, understanding these trends is what's most important, and we have very good data on hospitalizations and deaths as well. So those will be ongoing, reliable indicators of the prevalence of disease. You could think about this a little bit in the way we monitor influenza. We have sentinel sites, certain laboratories that we monitor to understand when influenza has arrived in the community and how much disease activity is happening based on how many tests are reported positive and how many are done overall. and we can track nationally through special studies, influenza-related hospitalizations and deaths. And ultimately, I think we'll transition to a system more like that for COVID-19, because for the public health system in general, it's not as necessary to know every case. Now, for the patient, for the person who's infected, yes, it's important to be to know if you have COVID-19, if you need to seek medical care, if you're seeking treatment. That's an important thing, but it is becoming less important for the public health response to know every single case. We will know when we peak because we've got lots of testing going on, and we'll be able to see a leveling off. Now, there will be additional cases even when we peak that we won't be measuring, but that trend is what's most important, and we will be able to clearly understand when the trend in cases changes and when it drops. Now, when that's going to happen, I have always tried to emphasize how unpredictable this disease is and how fraught any sort of prediction about COVID-19 is. I mean, who would have thought we'd be in the position we are today with Omicron when we were anticipating? I was anticipating coming out of the Delta surge and having, a much more mild 2022, and then this highly mutated variant developed. And so there's a lot that's unpredictable about COVID-19 across all fronts. But with respect to predicting when a particular outbreak is going to peak, there are a couple of things, that are taken into consideration. One is, what's happened in other countries. And as I've mentioned, we can draw some conclusions from that, but we also have to be cautious because, other countries aren't necessarily like our country for those reasons that I described earlier, different population, age, underlying conditions, behaviors, and prior immunological status related to past infections and vaccination coverage rates, and so on. So, what happened, for example, in South Africa may not be a very good indicator of what's going to happen in the US. On the other hand, if you look at country, also they were in the summer season, we're in the winter season. So that's a potential difference as well. This virus transmits differently under different environmental conditions. But you look at a country like the UK, which is more similar to the United States, what happens there may be in other European countries may be a little bit more informative. So, they're not over their peak yet. There's a lot of speculation because of what happened in South Africa that the peak may come in 4 to 6 weeks, maybe 8 weeks, and then there may be a rapid fall off. Now that makes a lot of sense because the other thing that we consider is just, the transmission dynamics of infections. These viruses spread through human interactions and behaviors. And, when people become infected, they have some immunity from reinfection. When people are vaccinated, they have immunity from infection. So taking together the level of vaccination in our community and the level of past infection and the large number of people who are becoming infected, at some point, the virus is going to run out of people to infect. And so our infectious disease modelers, like our colleagues at the University of Washington, Fred Hutch, Trevor Bedford, and others at the CDC, they can take these factors into account, and they can, through mathematical models, sort of say, okay, at a certain point, there are going to be so many people infected that this virus is going to have a hard time finding new people to infect, and things are going to start slowing down. And so on the basis of these types of models, and each one makes different assumptions about the underlying factors, there are predictions about when our Omicron wave may peak. So I call them guesstimates. And my personal guesstimate, based on what I've read and heard from people who do these types of models, is that I would expect that we would peak here sometime, ballpark middle of January. Now, I could easily be off by 2 weeks either way. And then I would expect, because of how many people have become infected so rapidly, that in fact we would see a more rapid decline than we saw with variants that were less infectious, like Delta and Alpha and the previous variants. So I do think that once that virus sort of hits the wall with running out of people to infect, things will improve quicker than they have in the past. It's important to understand, though, that the impact on the healthcare system and the community, that's delayed. So, hospitalizations occur, a week or two after infections, and deaths can lag by even longer. And then, people are out ill and so on. And then there's also the issue of long COVID, which is something that's really not yet well characterized, and we need to learn much more about in our community, in our country. So that is kind of my take on the prognostications. I don't think you can say too much with certainty, but people can make educated guesses with understanding the caveats and the limitations.
Great, thank you. We have one final media question, and then we're going to take one question from community on Facebook. So for our final media question, we have Seattle Chinese Radio. Go ahead.
Hello, Dr. Duchin. My question might be asked and answered, but my situation is different. We booked a theater in February for an art performance show, but we are worrying about the pandemic. So if the Omicron is not going away soon, how likely and how soon will the county issue another restriction order about indoor or outdoor gathering?
Thank you for your question. Thank you for joining us today. I think at this point, I can't predict if and when we will need other additional restrictions beyond the guidance that we're giving at this point. And the guidance is, at this point, avoid crowded indoor settings to the extent possible. And if you do have to be in a crowded indoor setting, wear a very high quality mask or respirator. So, for example, if I had theater tickets for the month of January, I would not plan on going personally. And I would encourage others to limit any types of activities in crowded indoor settings to the extent possible during this month. Now, a lot will depend, and by the time we get to February, a lot will depend on what happens between now and then with respect to the need for any additional restrictions beyond the guidance that we're issuing, which, if people follow it, should be adequate to limit to the extent that we can the transmission of this virus. But trying to predict exactly what the situation will be in February is very difficult. I think it's possible that transmission rates will be low enough so that you could have an event in February where everyone's vaccinated and ideally boosted if they were eligible for a booster. If it was a really well-ventilated space, that would really help a lot. That's the other key, in addition to vaccination, boosting, and high-quality mask, respirator, ventilation. So there's a number of things that you would consider, and a number of uncertainties about what's going to happen between now and February. But I anticipate I'll be doing another briefing or two between that now and that time, and feel free to join us again and ask again as we get closer.
Great, thank you. All right, for our final question, we're taking questions from community on Facebook. We're hearing a lot of questions about natural immunity from prior COVID infection. And one question is, for King County's vaccine verification order, why isn't proof of prior infection counted to allow people into indoor settings for that?
Yeah, this great question. This has been a problematic issue from the beginning. Clearly, with Delta, people who had prior infection some people who had prior infection had very good protection from reinfection for some time frame. At the moment, the CDC is basically said that 90 days is the time frame after which someone has a natural infection, confirmed by a viral test, for example, that they don't need to quarantine. But we do know that not everyone who has past infection does get immunity for current infection. And we don't have a good standardized way to document past infection that would be practical for a vaccine verification program. So I do acknowledge and understand that this is one of the limitations of our program, that there are some people out there who have had past infection, who have current immunity, or at least have immunity against the virus for which they were infected with, and are not able to, unless they're vaccinated, participate in those settings. However, things have changed with Omicron. People who've been infected with Delta, which are the vast majority of people who've had past infection, are more susceptible to reinfection with Omicron than they would have been to a reinfection with Delta. So it's really important to understand that even if you've been infected in the past, vaccination does add additional protection. And it not only gives you a better protection against reinfection, but it also gives you better protection against a wider range of variant viruses. So, if at all possible, people who've had past infection really should be vaccinated. And of course, that would then provide them with eligibility in settings where vaccine verification is required.
Great, thank you so much. That's it for our questions. So Dr. Duchin, I'll hand it to you for any final remarks.
Well, thanks, Kate, and thanks again, everyone, for joining. The people of King County have done such a remarkable job at limiting the damage from COVID-19 throughout this pandemic. We have among the lowest total case and death rates in the country when we look at our rates compared to all US states and territories. And we've done this by layering multiple defenses and looking out for one another. Now, with Omicron, we need to use multiple layers of protection again to slow the spread and to decrease the number of COVID-19 cases, take pressure off our hospitals, our emergency rooms, and our healthcare providers who are asking for our help. Vaccines and boosters provide solid protection from what's most important, hospitalization and death. Our relatively high vaccination coverage rates in King County are without a doubt preventing what would otherwise be an even larger surge of serious COVID-19 illnesses. And we need to continue to vaccinate and boost. But just as we can't take our hands off the wheel at 70 miles an hour just because we have our seatbelts on, to get us through this surge, we can't rely on vaccination alone, even though it's our single most important tool. We must continue to mask using the best quality and best fitting masks or respirators possible. N95, KN95, and KF94 are the most protective. And that's followed by snug fitting surgical type masks and multi-layered cloth masks if there are no better options. Limiting large gatherings and indoor activities in crowded or poorly ventilated spaces is especially important right now. Staying home and away from others if you have symptoms or are exposed to COVID-19 and not up to date on your vaccinations will help protect others from infection. We've shown what we can do when we work together, and right now we need to dig deep for a renewed community-wide COVID-19 prevention effort over the next few weeks. These coming weeks for many may be the most difficult yet. Please take good care of yourselves and do what you can to help one another. Despite the recent setback with Omicron, the overall arc of this pandemic will be improving, and we will get through this. And I expect 2022 ultimately will be a much better year. Thank you, and I look forward to speaking with you again in a couple of weeks.
Thank you so much, Dr. Duchin, and thank you to all of the media partners and community members on Facebook who joined us today. As a reminder, you can follow along with our work on our blog, www.publichealthinsider.com. Thanks so much and Happy New Year.